Hi, I'm Kaylin, and I am a cystic fibrosis advocate. Cystic fibrosis is a genetic disorder that causes abnormally thick and sticky mucus to build up in the lungs and digestive tract, depending on the genetic mutation that you get. There's several hundred different types of mutations, and each impact every person differently. So with the abnormally thick and sticky mucus in the lungs, this allows for a lot of bacterial and viral infections to occur in the lungs, and people with cystic fibrosis are commonly sick with pneumonia. And then those impacted by the digestive portion of it fail to absorb nutrition, and they don't grow as tall as they should be because those enzymes that would normally lead the pancreas to break down the food can't because the mucus is in the way. So they are malnourished and can't digest food by themselves. So the reason that I advocate for cystic fibrosis so passionately is because my cousin Josh was born on August 9th with cystic fibrosis in 1983. Cystic fibrosis impacts 30,000 people in the United States and 70,000 people worldwide. It is a terminal illness, it's life-threatening, and there is currently no cure. But thankfully, thanks to donations to the Cystic Fibrosis Foundation, which is a nonprofit, non-government funded organization, there have been advances in technology that have allowed people with cystic fibrosis to live not just into their 30s, but now their 40s and 50s, which is really unheard of. And now some women with cystic fibrosis are having children, which is unheard of in the last decade, honestly. So my goal is to advocate, educate, and bring awareness to cystic fibrosis so that one day we will have a cure for cystic fibrosis and families won't have to go through all these treatments and hospital bills and things like that. So this is Josh at 3 weeks old. He was not supposed to survive because when he was born, they had to fly him down to Shands to remove a digestive intestinal kink, so that he could pass food and everything. But thankfully, we got to take him home at 11 weeks old. So, people with cystic fibrosis, they don't have an adequate lung capacity, so they're often very pale, and because, as I stated before, they can't absorb nutrition very well, they're very thin and skinny, and they don't grow much. So, this is Josh, and he exhibits the whole paleness and the tiny little legs, and that's just normal, like, baby diaper, and it's like huge on him. And they often have to undergo several different kinds of treatments. This is my grandfather doing respiratory therapy on my cousin. So before the vibrating vest was invented by the University of Minnesota, caregivers would have to literally like sit there and beat on the child's back and chest so that the mucus in the lungs could be broken down and coughed up and out so that it wouldn't cause as much illness. And now that there is the vibrating vest, patients can put on the vest and sit there while it shakes them for anywhere from 15, 20, maybe 30 minutes, and that has really improved the life quality of those with CF, although it can be painful for people with cystic fibrosis to undergo that treatment. So along with the vibrating vest, people with CF have other respiratory therapies. Like here's a list of all the ones that my cousin did. Ones that he did every day were the albuterol inhaler, as well as a hypertonic saline. And then he also would do colistin and Ventolin when he was sick with an infection or needed a tune-up. Then for the digestive part of it, he had Prevacid for esophageal ulcers caused by the pancreatic digestive enzymes, and then Ursodil for elevated liver enzymes. And then he also did vitamin K shots as like a for his blood, and then vitamin A shots for his vision because he was pretty much blind at night. And when he would have a bacterial infection or something like that in his lungs, he would do what we called an IV cocktail, and that include several antibiotics such as Zosyn, vancomycin, tobramycin, Pulmzyme, and azithromycin. And these would help kind of bring him back to a stable condition, I guess you could say. And so here he is at 3 years old. Cute little guy. He's pale and, you know, not really growing for a 3-year-old. And then they always told us, you know, like, oh, like he's not gonna make it to elementary school, and he would. And then they're like, oh, he's not gonna make it through middle school, and he would. Here he is in elementary school. Cute. And then they're like, oh, he's not going to make it to high school. And he did. Here he is working his first job at 16 at Sonic in our hometown. And even more amazing is he graduated high school. And that was a miracle, just because about the age of puberty, that's when this disease really amps up for people, because you have different hormones and chemicals being introduced into the body, and it just really shakes up the whole thing. So then he went on to college at Kaiser University, where he studied culinary arts, and he worked at Bonefish Grill here in Tallahassee, Florida. Mm-hmm. And his dream was to own and manage his own restaurant. And he came very close, but he got really sick when he was 24. This was probably the best he would ever look, honestly. At 24, he had a digestive blockage, but the doctors failed to recognize it and instead removed his appendix. And during that operation that he barely survived, he contracted MRSA in his lungs, which kind of put a death sentence on him, honestly. So after that, he went from going to the doctor once, twice a year to every couple months to every month, to where we would just call in antibiotics and things like that. So you can see he's gotten smaller. He's pale because he's not breathing as much oxygen. This shows just how small he really is. And then in 2011, this was Thanksgiving, he was really sick. At this point, he was on oxygen and needed a BiPAP machine at night because he would just stop breathing. And again, you can see how small and pale he is compared to everybody else. And here he was around Christmas time. Something that I always admired about Josh is that he was always positive about his disease. I never heard him complain about it. And we'd always joke around, you know, like cystic fibrosis is genetic, so it's not contagious. So we'd be like, oh, we're not going to drink after you because we don't want to catch your CF. But he was fine. So here he is again. This was also like right after Christmas. You see just how thin and pale and just malnourished he is. And again, just very sick. So every year my family participates in the Great Strides Walk that is hosted by the Cystic Fibrosis Foundation. And what that walk does is raise awareness as well as funds for the research for cystic fibrosis, because the foundation is not funded by the government. It is funded solely on donations and really this walk. And so we had team shirts, and here he is with his Jogging for Josh shirt. And we always, again, he joked around so much, you know, oh my gosh, it's Josh. And here's him and his mom. Unfortunately, 2 days after that walk, we would lose Josh to cystic fibrosis. This is his funeral pamphlet, and this is why I advocate so heavily and raise so much awareness, because probably one of the hardest things I've ever had to do in my life is stand before 300 people and talk about how great my cousin was, how much of a friend and supporter he was to me and everyone around him. He impacted everyone that he ever met, and I, to this day, 4 years later, miss him so much, and I'm sorry, but I don't want other families to have to plan funerals and write obituaries for their family members or friends, especially since we are so close to a cure. So even though Josh's battle has ended, mine had only begun that day, to continue to educate and advocate and raise funds for a cure, and it won't stop until there's a cure for every mutation of the disease. So in my post, I'll include a link to the website where you can check out more information about CF, as well as other research and clinical trials that they're doing right now, as well as donate if you feel led to. And again, just thank you for watching this, and God bless.